So our goal for this exercise is to increase your internal rotation of your hip. We're going to do so in a neutral hip position. So our target is going to be my left hip. Before I worry about any rotational capacity, I need to take care of the sagittal plane. That is my forward and backwards pelvic tilt. So the first movement, I'm going to go into my posterior pelvic tilt like this, engaging glute, as well as going buckle the belly button like that. Okay, so if I don't keep that glute contraction, what's likely going to happen is my femoral head will push on the front of my hip socket, giving me a little bit of irritation. What I am then going to do, maintaining that glute contraction, you can see I have the kettlebell. Anything would be beneficial as long as it's stable. Okay, so about 20 pounds, and now I'm at the end range of my hip internal rotation. I get into my posterior pelvic tilt, buckle the belly button. I'm going to do a nice deep breath. This would be one phase. Phase one, we're going to do 4 of them. Phase 2, I'm going to actively try and go into my external rotation. That means I'm going to push actively into the kettlebell whilst maintaining good glute activation. Again, lower abdominals are engaged, keeping the ball centrated in the socket. I do that as hard as I can for 30 seconds, gradually, incrementally increasing the pressure. Phase 3, I'm going to actively go out and try and windshield wiper my leg away from the kettlebell. There may not be much articulation because you're already at your end range, and that's fine. The intent and the muscle contraction will help to enhance tissue change and actually improve your range of motion over time, despite in the moment not having an actual change in the articulation. Good, and I'm really fighting, really working my safest, greatest contraction, trying to slide my foot out away from that kettlebell. Phase 4, I relax that pressure. I still keep in the glute and the lower abdominals, breathing into the slight new position that I've achieved. Starting with working on hip internal rotation in a neutral hip position versus trying to do it in a flexed hip position will mitigate the amount of sensitivity that you'll have around the periarticular tissues about the hip.